I think like millions of other, not only Americans, but people around the world, COVID opened my eyes.
There are many people out there that are trying to deliver this information to the public, but it can't get there if we're hung up on this narrative that the mRNA vaccine was both safe and effective. It was not safe and it was not effective.
And we've had a almost complete corruption of science here in the United States. And that's got to be fixed.
What are the interventions I can take right now to help my body get rid of some of the spike protein?
You know, what we all have in common is we love this country. We realize how rare and precious it is, and how it's our solemn duty to make sure that we pass along to our kids.
I'm Nicole Shanahan. Welcome to Back to the People podcast, which highlights the growth of a movement uniting America, where our government is free from corporate capture and where we give voice back to the American public. Senator Ron Johnson, thank you so much for joining me today. I've seen your name circulated as a oftentimes involved in really issues around integrity of our government, and a lot of the top causes you've thrown yourself behind are election integrity. That was a big one over the last several months. You feel very passionately about our immigration policy as well, and you've spoken very eloquently about how we get to true immigration reform. We can't get there until we have a proper border and border security. And you've been a real champion of the Make America Healthy Again movement. And that's one that I'd love to start with, because members of Congress, they've hesitated to express their support for Robert F. Kennedy running as an independent. And in fact, I couldn't get anyone on my podcast from the Republican Party. I reached out to probably about 8 or 9 folks, but I couldn't get anyone to come on my podcast until we had suspended our campaign. But, now I realize I should have reached out to you, because I bet you would have said yes, because you've been a real advocate. What has brought you to seeing a benefit in this work and encouragement of Bobby's campaign?
Well, you're right. I would have said yes in a heartbeat. I think like millions of other, not only Americans, but people around the world, COVID opened my eyes. I remember running in 2010, and by the way, my campaign told me never to say this again, but I said, Big Pharma. I mean, am I the only guy that wants a new life-saving drug? So I defended Big Pharma back then. And I'm a private sector guy. We do need drug manufacturers. We need researchers. We do want to create life-saving drugs and other things. But what I certainly saw during COVID was a corruption of the process. And I think this repeats itself probably in every federal agency, every department that is regulating large corporations. Those regulated entities, they figure out a way to capture those agencies and then use those agencies to their benefit, generally to the detriment of their competitors and to the public at large. And I think that's what was definitely revealed during COVID, when we saw early treatment completely sabotaged. I mean, that made no sense whatsoever. Where we had people like Anthony Fauci deny the validity, the benefits of natural immunity. I would always, think, well, what do you think your vaccine is going to rely on? It's going to activate your natural immune system. Why was half of America or half the world population infected with the coronavirus and show no symptoms? Well, that's because their natural immune system took over and knocked down the coronavirus before it even created symptoms. So again, there's so much during COVID that made no sense to me whatsoever. And when people like myself or RFK Jr. or others asked questions, we didn't get valid answers. They were legitimate questions. We didn't get valid answers. Instead, we got attacked, we got vilified, we got censored. And that just raised my suspicion further. So I certainly appreciated, and I'll call him Bobby, because I've gotten to know him, I've gotten to respect him. And the respect starts from the fact that he never sought to get involved in, for example, childhood vaccines. But during his, and you know this far better than I do, but the story as it was related to me is, as he would be giving environmental talks, you'd have moms in the front row with their T-shirts on, asking him to, explore vaccine injuries. And it was finally one mom found out where he lived, came with a stack of research papers, and said she wasn't going to leave till he read them. And to his credit, he read them. And further to his credit, once his eyes were opened, he didn't turn his back on those mothers. And I think that's what we've seen. We've seen, as more Americans, more people around the world, as their eyes have been opened to the capture of these federal agencies, to the corruption within Big Pharma and these federal health agencies, they're not closing their eyes. And so I think we have a unique moment in time where hopefully this coalition of people from across the political spectrum can put their differences aside on other issues and focus on this vital, this crucial issue to American and global health.
Yeah. And you're a member of the Senate. This is, I believe, your third term. Is that correct?
Correct.
When you ran, you didn't run on these issues. You didn't run on vaccine injury or corporate capture issues, is my understanding. This is something that developed for you as you experienced this firsthand. And you're a member of Congress. You're surrounded by these other elected members of the Senate. And you're seeing things and you're just using a reasoned, logical approach to asking questions during the pandemic and during the rollout of Fauci's policies. You're asking these questions, and what was that experience for you to be asking these questions, which are the reasonable, correct questions to be asking, and then seeing your, fellow senators either refusing to ask those questions or asking those questions and then watching things happen in and around them. And you're starting to spot these inconsistencies. I think, a lot of what I try to do with my podcast is give people the human understanding of what this experience is like, and you're somebody who, goes into government, representative elective office for various issues that might not be this issue, but then you find yourself adopting this issue more and more. And then you're seeing a, grouping, almost a social reorganization of the Senate around this one issue. What does that feel like? I mean, it must feel surreal almost to see who's in it for the right reason and who's being influenced.
Well, I'll just give you a little history. So during the pandemic, I was chairman of the Committee on Homeland Security and Governmental Affairs. It's certainly not particularly really involved in healthcare issues, but nobody else was holding hearings. So I held hearings very early on in February, found out that America doesn't create precursor chemicals or the active pharmaceutical ingredients. In May, I followed up after the Princess Cruise and John Ioannidis' study showed that, coronavirus is very dangerous if you're elderly, if you have certain comorbidities, but it wasn't Ebola, it's not SARS, it's not MERS. Might be worse than a bad flu season, okay? So don't be freaked out about this. Then I followed that up with hearings in November and December of 2020 with Peter McCulloch on hydroxychloroquine, using that as early treatment, then with Pierre Corey in December of 2020 on ivermectin. Now, throughout that time period, again, I was being vilified just like those doctors for having the temerity, I guess, to point out that we really ought to be trying to treat these patients. I was all in for anything that would end this pandemic. So I was a supporter of Operation Warp Speed, but I had the opportunity to talk to Michael Yeadon probably about October 2020. He's 30-year employee of Pfizer, specializing in toxicology, a vice president of research. He was beside himself when he found out what his colleagues were doing. He could not believe they were literally producing an injection that was going to turn the body into a manufacturing site for something that was toxic to itself. This would biodistribute all over the body. So there was no way I was going to take that injection. And the reason I did run again, although it wasn't central in my campaign in 2022, I had no intention of seeking a third term, but nobody else was advocating for vaccine injury. I saw very early, March, April, watching the various reports, watching deaths skyrocket. At that time, 46% of those deaths were occurring on the day of or within 1 or 2 days of vaccination. And when I confronted Francis Collins about it, his reaction was, Senator, people die. I mean, that cavalier type of attitude. And so literally I held a panel in, I think, June of 2021 where I allowed vaccine injured individuals to tell their story. And again, they did not obtain the type of sympathy, the type of support that they should have garnered. But getting back into, what was happening in the Senate, as I was holding these hearings, I was telling my Republican colleagues in particular, we had Democrats on the panel, they would boycott the hearings, quite honestly, or in case of my ranking member, Senator Peters, just insulted Pierre Corey, which is what led to his, very passionate statement that went viral that eventually got taken down by YouTube, talking about ivermectin. But internally, they were just ignoring what I was trying to reveal, that this wasn't, as dangerous as MERS or SARS, that there was early treatment available. Again, I was holding this before the vaccine got emergency use approval. So I would go to lunch, say, there is early treatment here. We ought to be promoting this. They just ignored it because everybody was, I guess, enamored with Anthony Fauci. And then I think here's the real key. Once the vaccine got the emergency use authorization, again, we all wanted to see the pandemic end. Now, because I was already warned, I was going to try and use my platform to warn other people, be informed about what this is. Okay. Whereas my colleagues, that they were cutting videos telling people to get vaccinated. They encourage, like doctors, encourage people to get vaccinated. We saw obviously what happened during the Biden administration where they mandated vaccination. So again, all these people either supported the mandates or cut videos, encourage their constituents to get vaccinated, just like doctors. And at this point in time, once the numbers started coming out in terms of vaccine injuries, I had my chart, I'd take that to Senate lunch. Nobody wanted to believe it. Nobody wanted to admit they were wrong. And I think, Nicole, that's right now our biggest problem is societally. A very high percentage of Americans got those shots. They don't really want to face the reality that maybe there's still a ticking time bomb coursing through their veins. The people that in the medical establishment, in public officials, elected officials, they don't want to admit that something they push on the public or recommended to their patients might have killed them or injured them permanently. They don't want to admit it. So that's our biggest problem right now is nobody wants to admit they were wrong. And there just aren't that many people like myself or Bobby or you that are willing to really force the American public. No, open up your eyes. We have to look at this. We have to recognize what actually happened here so it won't happen again. So we can take a look at these mRNA shots that they want to roll out for just about everything and, call them on their lies. These things are going to biodistribute all over your body, and whatever is inside that lipid nanoparticle is going to do something to your body. And we better test it far more thoroughly than we did with the COVID injections.
Well, and also we could save some lives right now. As you said, those that have taken it, there is going to be some dysregularity in the immune response, and it evolves over time. And so it is time sensitive. If we could admit that this is what's actually happening to people who receive the injections, I received 3 of them. I encouraged people to get them. I was dead wrong. And I am amongst those individuals who's trying to figure out what are the interventions I can take right now to help my body get rid of some of the spike protein, to help my body find homeostasis in an environment that has been significantly interrupted by all kinds of immune responses that are very irregular. That can cause cascading effects. But there are interventions. There are many people out there, doctors, scientists that are trying to deliver this information to the public, but it can't get there if we're hung up on this narrative that the mRNA vaccine was both safe and effective. It was not safe and it was not effective. And so, how many millions of lives do you think we could save right now if we had more members of the government just being bold enough to come out and say, I was wrong?
Well, I think we'd save countless lives. And that's the reason I'm continuing to do this. And again, the reason I ran for a third term is to advocate for the vaccine injured and try and prevent further harm. Again, this is a platform that is very profitable for big pharma. They can design and have a new vaccine out almost overnight because they can just basically dial it up and create it through an email. So this is the ultimate, I'd say, in designer drugs and highly profitable drugs. So they want to use this for just about everything. And we need to understand the full extent of exactly what this thing does. And again, it does sound like a pretty cool format. I mean, people were working on this thing for decades, but they just never were able to do it successfully until they were able to ram it down everybody's, or I guess ram it into everybody's arm, and they made billions off it. So no, the public has to understand this. And again, that's one of the reasons I have so much respect for Bobby is he's willing to be nominated for HHS secretary. We're just seeing the beginning of what they will do to try and destroy him to make sure that he never becomes secretary of HHS. He's willing to get in front of the Senate, a couple different committees to do those confirmation hearings and basically tell senators the truth.
I think that was the happiest day millions of Americans who have personally experienced the harms of vaccine injury have had was when Donald Trump nominated Bobby to HHS. I know the feeling I had was one of relief. The sun shone brighter. The air smelled crisper and sweeter than it has in a long time. For the first time in a long time, many people have hope. And we know that's a lot thanks to you too.
Well, listen, where I got that first injection of hope is when Bobby called me up before he made the decision. And he just called me up to see what his chance of confirmation would be. But the first words out of my mouth were, Bobby, this is an answer to my prayers. Because, again, not only is he going to bring his expertise and his passion to chronic illness, vaccine injuries, but our nation has serious, massive problems. And one of them is that we're a horribly divided nation politically. And as I've been saying ever since he made that decision is, both he and President Trump, I think, deserve an awful lot of credit for laying their differences aside, focusing on an area of agreement. And again, not only to solve that particular problem, but demonstrate to Americans, this is how you heal a horribly divided nation. This is how you unify a nation. And it's going to be a whole lot easier solving these massive problems if we're a more unified nation as opposed to, horribly divided. So again, I just give Bobby all the credit in the world. I want to do everything I can to help him get that confirmation. And then once he's in that position to communicate to the public, here's the reality. This is how these federal agencies lied to us. I mean, here are the emails now that have been FOIA'd, that now we've received unredacted to show you exactly what they knew and how they knew they were lying to the American public. And I think in doing that, it'll open up, millions of more eyes to the corruption and what needs to be fixed, not just in our federal health agencies, but in just about every regulatory body, every department that has been captured by big corporate interests. Again, I'm a private sector guy. I have no problem with big companies. I've got a problem when big companies use their power to corrupt the process. And I think that's what's happened time and time again throughout government because of big government. It's the nasty reality of big government doing things our founders never intended big government to do.
Yeah, there's a lot of truth to that. Many of the pharmaceutical companies and their top investors have had emergency meetings over the last week, and I've been hearing rumors about it. And we get our calls as well, and people are like, "Is this really happening? Is this actually happening? Can you give us some insight as to what Bobby's going to do?" And I was like, "Look, it's not about Pfizer being." Or pharmaceutical companies being bad, right? They've done some very bad things, but the idea of them in and of itself is actually quite positive. Do the research, come up with interesting treatments and drugs, and just be honest. And if the vaccine works, that's wonderful. If there are injuries, let's understand and screen those populations in advance, and come up with different schedules. Mumps, measles, rubella, it's 3 in 1. If you talk to some of the doctors, when they vaccinate their kids, they actually seek out each of these vaccines separately. Measles vaccine separate from the mumps and rubella, and they'll give their children that single shot, on a slightly different timeline. we have so many things we can do to save this industry and to save these companies. It's not necessarily we want Pfizer to disappear overnight. And we don't want the stock to tank. In fact, we'd love for it to be a successful stock that is directly tied with health outcomes. I mean, if that was the case, we wouldn't have a problem here. But that's not the case. That the increase in their stock price over the last 10 years has been directly tied to many injuries that have been swept under the rug, as that has been the case with Merck. And so the correction we're seeing right now is the right one, that they made a mistake. The company has failed in its duty to deliver a safe and effective product, and it's time for them to readjust. And so one of the arguments I've heard, and I think is a very good argument, is that if they focused on treatments, right, effective, safe treatments, and really, push those out and did safety studies and did population studies, because there are sensitive populations to every drug, that they would be able to rebound their stock in a matter of a year or two. And so, this argument that Bobby coming into HHS is going to be disastrous to pharma, I actually think is the wrong argument. It might be the best blessing for the long-term success of these companies if they have the willpower to turn it around and make the right decisions financially for themselves. Because at the end of the day, we have a free market in this country, and we have to utilize those levers to get to what we want, which is a healthier nation and drug companies that are helping people and not harming them.
So in order to make that a reality, I think you have to address three very fundamental problems.
Mm-hmm.
And I think the first fundamental problem is what President Eisenhower warned us about in his farewell address. It wasn't just about the military-industrial complex. He warned us about public funding of basic science and research and how that would corrupt basic science, and it has. And so when you take a look at, for example, Wiley academic publications, having to shut down 19 academic journals, retract more than 11,000 compromised studies. When we have the head of the editor-in-chief of the New England Journal of Medicine, I think her name is Marsha Angel, quit in 2020 and then start writing articles about the fact that, and I actually have the quote here. Let me take similar, this is a quote from Marsha Angel. Similar conflicts of interest and biases exist in virtually every field of medicine, particularly those that rely heavily on drugs or devices. It is simply no longer possible to believe much of the clinical research that is published or to rely on the judgment of trusted physicians or authoritative medical guidelines. I take no pleasure in this conclusion, which I reached slowly and reluctantly over my 2 decades as an editor of the New England Journal of Medicine. Again, now, she resigned in 2020, I think, because of this, or in the year 2000. That's 24 years ago. We are seeing in, I think, Nature magazine in May of 2016, they published an article, a study that said 70% of studies could not be reproduced. So we've seen the corruption of medical research. That's a real problem. I'd say another fundamental problem is pharmaceutical advertising. Again, I'm a private sector guy. I believe in free speech. But when I've seen what that did to corrupt the process, again, you look at any pharmaceutical advertisement, there's no way you'd take that drug based on all the side effects they start labeling, and they don't tell them all. Okay, so the only reason they advertise is to be able to capture the narrative like they captured it during COVID. I mean, that's a real problem. And that's a fundamental problem that has to be addressed. Those, and then I think that the third fundamental is the fact that vaccines, have no liability whatsoever. They're completely protected from any kind of liability, which is why drug companies just love vaccines and why the number of vaccines we give children, are over 80 doses now versus the 3 doses that Bobby and I got when we were young. So again, to me, those are 3 fundamental problems. The powers that be are going to be, they're going to be dragged kicking and screaming to reforming that. I think that's the real threat that Bobby poses to those companies is that they like the protection they have. They like the situation they're in. That they like the fact that they're the ones that pay for the science that drives whether or not their drugs get used or their pesticides get used or their products get used. They don't want an independent look at that. And I'll close on this point because we had an event with Bobby and Dr. Casey Means. But one at the end of September, I think one of the best piece of testimony came from Dr. Chris Calmer, who said whoever they are, they don't want to discover the root cause of these chronic illnesses. They don't want to discover what's really causing autism. They don't want to discover what really happened and why all these adverse events skyrocketed after the injection of the COVID injection. So again, they want to keep the public ignorant, which is why they've never done a placebo-controlled trial on any vaccine on the childhood schedule. I was shocked to hear that.
What do you think the path is to repealing the 1986 Vaccine Safety Act that removed liability from the manufacturers? Is it another executive order? Because it was created via executive order, wasn't it?
Yeah, it was. Barbara Loe Fisher lobbied for that bill, and it did not include that liability protection, but it was kind of the wink, wink, nod, nod of the people passing it as, we'll take care of this, and they did take care of it through regulatory. The solid path is you start with the truth. You start by exposing the reality. It has to start there. The public has to come up to speed. That they need to be informed. More Americans have to have their eyes open, like millions already have, because it's going to be an onslaught, and they will use corrupted science to undermine Bobby. So this is going to be truth. I mean, that's what we have on our side, even though we are up against powerful interests. I mean, 2 weeks after I held my public event, I'll just quick flash it, but the chairman and ranking members of the agriculture committees, both the House and the Senate, I was copied on it, got a letter pretty much not specifically refuting, but in reaction to our public event. And it's signed by well over 200 agricultural interests. Now, I personally come into this whole debate over, pesticides and food ingredients is pretty much an honest broker here. I think some pesticides are certainly beneficial. My problem is because the science has been corrupted, I can't tell you what's really the truth here. So the first thing we need to do in really being able to honestly enact what needs to be enacted is we need uncorrupted science. And I don't think we have it now on either side. I've got a real problem with that, is we do not have uncorrupted independent science.
It's really hard. I am a funder of science, of foundational science, and I've funded here in the United States and I've funded in Singapore. The quality of the work I've gotten from Singapore is so dramatically different than the quality of work I've gotten here. And the cost for the delivery of real science is like, you can spend hundreds of millions of dollars in the United States and literally move the dial not at all. Because it just gets drowned out. It gets flooded out by all of the corporate interests, the corporate takeover of the media, and the fact that the scientists are scared in our country. We actually now live in such a Kafkaesque environment around science here that the scientists themselves are too afraid to write what they actually want to write. They now have to publish around the statement that they're actually trying to make to prove, like, in such small incremental bits, and actually hide what they're ultimately trying to say in order to even get things published at all. And to continue to do the work that they want to do. In Singapore, you don't have that same level of interference. You have a little bit. It's here and there for sure. But I funded reproductive fertility research in Singapore, and I got real answers within about 2.5 years, looking into what's causing PCOS, polycystic ovarian syndrome. And they realized that it's not what we define it as here in the United States. In fact, it's our bodies trying to protect a woman's ovaries through ovulation, and that women with PCOS were actually more likely to have a successful natural conception and childbirth than women who didn't have PCOS. So PCOS is actually the body responding to an environment that is adverse to fertility. It's protecting the egg during ovulation. I mean, and it just goes to show that the human body is quite brilliant. It's really smart. It does all kinds of things to try to protect itself from the environment, this toxic environment that we're now living in. But that study won't come to the United States. It hasn't jumped. And they now are still treating women with PCOS as if they're needing IVF or unlikely to conceive naturally, when in fact that is a sign that the body is healthy. It's actually acting, normally and as it should, to protect itself and to, hopefully have a healthy conception. So I hear you loud and clear that we need more members of the government starting to tell the truth. Have you had any success in changing the minds of your colleagues?
Maybe a couple are willing to listen. We'll see. Again, when you take a look at the doctors who, for example, testified on my panel, I feel really guilty because I destroyed a lot of their careers. And it didn't take many to have their careers destroyed to have all the other doctors remain silent. I mean, I can't tell you how many doctors have come up to me and thanked me for promoting things like ivermectin and hydroxychloroquine because it works, but they wouldn't say anything about it. But again, they would be fired by their hospitals if they actually used it. So they have to use, figure out some other way of getting it to their patients. So you combine that with, again, just the pressure to publish research. That's what's corrupted the process. And again, then they will do research designed to provide the result that the funders are looking for. So again, we've had a almost complete corruption of science here in the United States, and that's got to be fixed. That has to be fixed. That is just a fundamental problem we have right now, and that's going to take some time.
I'm sure you've had this experience. I've had this very unique experience of receiving thousands of letters from doctors all over the world who have said to me, "Thank you so much for what you're doing. I fully believe in what you and Bobby Kennedy and like-minded leaders are doing in the United States. I want you to know that I've been trying to treat my patients accordingly. I know the truth about these shots." I have an OB here in Silicon Valley who whispered to me, I tell every one of my soon-to-be mothers, do not get the shot, but I can't say it publicly. And my response is you got to do it. You got to come forward, say it publicly. And maybe, and I even say to them, I'm like, look, I'll provide cover however I can for you. And that's been something that I think that has been very empowering throughout this movement, is encouraging doctors to come forward who are too afraid to, and providing cover for them either publicly, platforming them as much as possible, and then wherever there's legal defense needs, supporting those legal defense needs. Because, if someone's wrongly terminated for doing the right thing, we got to protect them. And our legal system is designed to protect them. But, a lot of folks, they can't handle the financial burdens of it. Is there something we can do as a community, as you're in government, I have a private sector foundation, there's got to be a way, and I think this applies to the media too. If you want to be a whistleblower, there's got to be a path forward for you that allows you to still have protection under the law for doing the right thing.
Well, we have all kinds of whistleblower protection laws passed over 100 years ago, and the government routinely just ignores them, and they destroy those whistleblowers anyway. And so, again, vilifying, destroying people is very effective at deterring other people to come forward. So what we need these watershed moments. And it'll happen. It can happen. I mean, take a look at what happened to tobacco. I mean, how long the big tobacco companies and their the people that prop them up inside government, how long they succeeded until all of a sudden they didn't succeed. And now, smoking rates are way down. So again, truth is a very powerful force, but we're up against forces that are trying to do everything they can to suppress the truth. But once the truth is known, more widely known, let's just take a look at the uptake of the current COVID vaccine. Like, very few people are getting it. So to a certain extent, we have succeeded. We just have to succeed so much further and in so many other areas. So I'm hoping that the election of Donald Trump and his selection of Bobby Kennedy will be one of those watershed moments. We'll need a lot of them. Again, there's been so much misinformation. There have been so many lies told that the public has bought, supported by so many people who are never going to admit they are wrong. Again, we're up against powerful forces, but again, truth has its own power.
Let's talk about the Senate confirmations. They're right around the corner. What can people do today to help Bobby get confirmed? Because he just needs a majority.
Well, I am encouraging as many doctors groups in particular. I do want doctors refuting the lies. And I would love, and I've told people this, I would love to have dozens and dozens of letters from individual doctors groups that are going to be refuting the doctors groups that are basically established to destroy him. Not real genuine groups, but groups by and large funded by the left. People have all kinds of different agenda items as opposed to the public health. So I would love to see like I say, dozens of letters signed by individual doctors, rather than coming from a group supposedly representing X number of doctors. I really want doctors who know the truth to get involved in this. And literally, what I've asked is refute the lies that are being told. That'd be the best way. And then I can read those letters in the confirmation hearing. I'll be in the Senate Finance Committee. That'll be one of the committees he faces. And I'd love to lay out those letters and read excerpts from the rebuttals to the lies that are going to be told about Bobby leading up to those confirmation hearings.
I think that's brilliant. And this is direction that we can actually take. So the groups that are being funded by Big Pharma and those individual groups that are trying to cover their asses at this point, they're very well organized. I know them. I've been around them. These structures involve, big tech money, private foundation money, institutional, money that comes from universities and research institutions that are trying to cover their asses. So there's a lot of organization right now to take Bobby down to ensure that he doesn't get confirmed. I will say that our ragtag group that wants Bobby confirmed, we have all of the energy. We don't necessarily have the organization. We're getting there. We're working on it. And so, I would love to figure out how to get doctors together with a greater degree of confidence, because many of them would submit letters if they had a degree of assurance that it wouldn't destroy their careers. What is the message we can get to those? Because I know that there's like tens of thousands of doctors out there that would be willing to sign this document if it was anonymous. They would do it in a heartbeat. But, we've actually got to put real names on these letters. And so how do we give those individuals assurance that if they come forward, that they will be joined by a group of real warriors that are going to see this through?
Well, first of all, I would argue that ragtag group of people you're talking about that embraced you and Bobby, they just got Donald Trump elected president. And that's a pretty convincing group of people that just did that against all odds. Let's face it, the corporate media, the legacy media, all these groups are aligned against Donald Trump, but the truth prevailed. I don't know whether you and Bobby were surprised at how warmly you've been embraced by patriots. I'm still Tea Party. I'd rather not join any of the parties personally, but I'm part of that group of patriots who love this country like you and Bobby do, that seek the truth. And I would say in this case, the truth prevailed. They couldn't keep pulling the wool over the American people's eyes that open borders were a good thing, that the little girls can really be little boys. Whatever the issues are, whatever is being told by the left, it didn't prevail. So that's powerful. And what I saw, and again, I follow X, I saw some of the ads you made for Donald Trump. They were extraordinary. And those things go viral. And that's helpful. I mean, do the same thing with what we've seen with COVID. I mean, you've got, you're a creative individual. You've got creative people working for you. Use that. God bless Elon Musk for saving X so that we have one platform that actually does believe in free speech and that freedom of expression. So again, I have to. I'm not much of an optimist, quite honestly. I mean, I just see this nation on a horrible path right now. We've been given a 4-year reprieve. We need to be smart. We need to govern wisely. We need to do this at a steady pace. You can't just. I realize time's short, but you have to lay down the foundational information for the public to support what it is you're doing. So I would start. Right now, I would lay down that foundational information. You use what platforms you have, use your creativity, and communicate with the American public. Create support for Bobby Kennedy. That's what I'm going to do in my imperfect way, but I've got a platform to do it to a certain extent. You have as well, so use it.
Yeah. Well, the difference between voting is that it's anonymous. So all of those doctors out there who voted for Donald Trump because of his alliance with Bobby Kennedy, that's asking them to do one thing, asking them to come forward with their license on the line. That's a whole nother ask. And that's where I think the bravery, we've got to encourage people to be brave in this moment. And that there's a great reward to the bravery on the other end. And so, it's interesting. I'm scheduled to speak with Steve Bannon later today, someone who I never thought in a million years I would ever align with in any way, because I was trained to believe he's the scourge of the earth. And here I am now realizing that my bravery has led me to meet all of these individuals that have risked everything to try to get the truth over the line and have been decimated by the media and publicly and just really cast out by this group of people that has so comfortably gotten away with their lives for so long. And they've tried to do similar things to me, and watching what they're doing to Tulsi is really interesting, because this group of individuals that sets these narratives, guys like Rudy Giuliani are easy targets for them. Guys like Steve Bannon are easy targets for them. But people like Tulsi Gabbard and myself are much harder targets. And so then they have to come up with even more egregious accusations and really invest, I think, about 20 times more in ruining these people publicly, because it just takes that much more work to do it convincingly. And so, that being said, though, Tulsi is as strong as she's ever been. It seems like the more they put in to take her down, the higher she rises. I'm several years behind her in that journey. But I am on that path myself right now. And I know you have been on that path for quite a while. I think that you've really arrived there as a populist, with the Tea Party, which, again, I had very negative an understanding of until recently, and realized that the Tea Party is truly just a pure populist, love America deeply, hate corruption more so than you could ever imagine. And here we are to get matching up around this, so many issues that are just really basic for the long-term viability of our country and the health of our nation.
Well, first of all, there's safety in numbers. So the first step I would take is, do some of these online polls like Elon Musk and show the doctors that they've got millions of Americans behind this. And maybe do something within that poll to encourage doctors to step forward, because right now a real danger for all doctors is so many of us have lost faith in the medical establishment. I mean, afraid to go to doctors, afraid to go to the hospital. In terms of what happened. I'm not making this up. It's just true. Okay. It's interesting that you mentioned your thoughts of Steve Bannon. I know Bobby in our public event in September said he used to think of me as a supervillain. And by the way, I never thought of Bobby that way. I always looked at him as, first of all, a very sympathetic figure. Lost his uncle, lost his father at a very young age. Didn't really follow the troubles he had in his life. But when I got to know him, first of all, first thing you realize about Bobby Kennedy, he's just a really good person. If you didn't already know it before, also a very smart person. And that is really the coalition now that's assembling, because of Bobby, because of the risk he took, that you took. First of all, running for president and supporting his effort, getting the notice, and by the way, getting the notice primarily just on conservative platforms, right? I remember when Bobby said early in the campaign that this would be the first presidential campaign decided by podcasts. I at the time I thought, I wish that were true, because then Bobby might have a chance. But in the end, it turned out to be true.
Oh, 100% it was a podcast presidency. Yep.
And what the beauty about that is, as opposed to going on a cable TV show with a 5-minute hit where the host talks for half the time you talk, it's all condensed. Long format podcasts like this, you can actually discuss issues in greater depth, still imperfectly, and you can always delve into things in a deeper fashion. But this is how you change the narrative. This is how you open up more people's eyes. And again, once their eyes are open, once people understand the full depth of the reality and the truth, they're not going back. And so that is what gives me, somebody who's generally pessimistic, a great deal of hope.
Yeah, I have hope for the first time in a long time too, and I'm learning about what has been called the deep state. I don't really know what that means, the deep state. I'll be honest with you. I've been trying to, people use it. It's a term that gets thrown around, usually very negatively related to corruption and collusion. Epstein is oftentimes thrown around in it. I don't really understand what the deep state is. How is that like a term that members of Congress use? But is this like well understood that there's this shadow government operating that is multi-generational? Is that widely accepted as truth, or is that just something that we talk about in popular vernacular to mean corruption in the government?
Well, as someone who never came here to be an investigator, but became an investigator because I was chairman of the investigatory committee of the U.S. Senate, I investigated the deep state. It definitely exists, and it is corrupt, and it's generally from one side of the political spectrum as well. So no, I could spend hours talking to you, exactly, what I've learned about the deep state, but the basic problem, again, the fundamental problem there is government is way bigger than our founders ever envisioned. It's doing things that it's completely incapable of doing. Not doing it well. I think the federal government causes or exacerbates more problems than it ever solves, and that's the root cause. If you want to fix it, I don't think you're ever root the partisan actors out of the deep state. You just have to reduce the size of the deep state. You have to reduce the size of government, the scope of government, its influence over our lives. I mean, the founders never envisioned a federal government that's going to solve your problems. The federal government was primarily here to protect our individual liberty and freedom, provide for the national defense, which protects our liberty and freedom. And that is the mission of the federal government. Our founders were geniuses. They came from dictatorial monarchies. They understood the danger of tyranny. They didn't look at government as our friend. They realized it was necessary if we didn't want to live in anarchy and chaos. But because they feared it, they tried to set up a system that would limit it. But over the 250 years, the federal government has completely escaped the constraints of the Constitution, of the enumerated powers, and now we got this big mess on our hands where the federal government's mortgaging our children's future and trampling on our freedoms. As the government grows, our freedoms necessarily recede. So it shouldn't surprise anybody that big government censored people like Bobby Kennedy, used all of its powers to make sure you stamp out that truth and call it misinformation. So again, the root cause is just the size of government itself and how it's, again, busted out of the constraints of the enumerated powers.
It's the size, and then it's also the size paired with the fact that corruption is now dictating most of the major functions of government. Is that true? Because
But that's always going to happen.
due to size.
Yeah. When something gets big, it's going to get corrupt, right? I mean, Lord Acton, power corrupts, absolute power corrupts absolutely. So that's why you try and limit these entities' power. You limit the power of big corporations. You have antitrust laws. You try and put in place a lean regulatory system to keep their power in check. But what ended up happening is the powerful corporate interests basically combined with the powerful government interests, and Americans in general just get screwed in that process. Who's looking after our interests? Like nobody.
Yeah, no, I think that's the major theme of today, is that this feeling that the American is on the chopping block right now. The average American citizen just feels like they've been on the chopping block term after term after term. And, I'll say that Donald Trump voters, they gave him a pass in the first term because he was up against a lot. He's up against a lot now, but I think that it's very different. There's a call for radical transparency. Do you think, just in terms of process, do we need radical transparency in order to cut the size of the government? Or do you think we can cut the size of the government without having to necessarily expose all of the levels of corruption and deep state? I'm using deep state now. I don't even know what that means, but how much of it do we have to get out there? You've seen it, you know what it is, but how much of it do we have to get out there in order to actually see change? Because the American public just wants to move on. Like, the American public just wants a government that cares, literally cares about them, not says they care about them, not points fingers at who doesn't care about them. They just want things to just have a semblance of adequacy so that they can live their lives.
So if I have a mission as a U.S. Senator, it is to wean as many Americans off the federal government as possible. Again, don't look to the federal government to solve your problems. It's mortgage your children's future. It's trampling on your freedom. So don't expect that someone like Donald Trump can come in here and fix government. What Donald Trump can do is try and dismantle the corruption of government. And the only way you do that is you have to reduce its size and its influence over our lives. And the only way you do that is the public has to support it. So you need complete transparency. You got to expose it all. Or certainly you have to expose enough of it so that the American public finally comes to understand, well, so if there's corruption in the federal health agencies because of the capture of big pharma of those agencies that are designed to regulate it, well, maybe there's corruption in the USDA, supposed to regulate, agriculture, but it's been captured. And maybe there's corruption in the military industrial complex as it's been captured by, all the, corporations that are providing all these weapons that are not improving our national security. It's harming our national security. So again, you start with one obvious example. And I guess in my case, I started with the FBI, the corrupt Russian collusion investigation, which still they've not been held accountable for that. But then during COVID, my eyes were opened up and I started focusing on the corruption of our federal health agencies by big pharma. And then, Bobby Kennedy comes on the scene, starts educating us about chronic illness, and you go, ooh, so we got a problem in big ag and in big food processing too. Okay, always knew about the corruption of the military industrial complex. I mean, just quick little example. Russia can produce 4.5 million 155 millimeter shells at about $600 a pop. The West can produce about 2 million, and we spend anywhere from $6,000 to 8,000 euros. We're getting completely hosed, screwed by the military industrial complex, and yet got people in my party who want to increase our military spending to 5% of GDP while we're running $2 trillion deficits. So no, Nicole, it all has to be exposed. But again, how do you eat an elephant? One bite at a time. So, I guess I'm going to bite off the COVID portion of this thing. I'm hoping Bobby and everybody there is going to really focus on what the public will support. How do you address chronic illness? Hopefully, what he can do is overcome they don't want to discover the root cause. and force the discovery of the root cause of these things. And again, he wrote the book Vax, Unvax with Brian Hooker. That's just scientific study after scientific study after scientific study that just shows the unvaccinated are healthier than the vaccinated on a whole host of different illnesses, including autism. So again, you have to look at those types of facts. And by the way, a reading list for people, and Bobby gave me a great one, but I would start with Dissolving Illusions, go to Turtles All the Way Down, read The Real Anthony Fauci, read The Wuhan Cover-Up, read Vax Unvaxxed. While you're at it, read The Creature of Jekyll Island. Read JFK and the Unspeakables. Read The Devil's Chessboard. Those are 2 reading assignments by Bobby to me. I mean, there's so much that you can read that can encapsulate this, and your eyes can be opened up very quickly. But we need more Americans to get that level of detail and that level of understanding if we're going to really fix this problem.
Well, I think they have it. I mean, that's why so many people voted for change in this election. Well, Senator Johnson, you're a real hero. I'm really happy that we finally got a chance to talk now, especially on the as we enter these Senate confirmation hearings. You've given us great advice and direction on how we can help you get this across the line. If there's anything else, please do let us know. There's a bunch of us out there that are watching with bated breath, but very, very hopeful that this confirmation is going to come to fruition. And my goodness, how wonderful that would be for this country.
Well, we just need to build and strengthen this alliance. Bring more people into it, again, of various backgrounds. And what we all have in common is we love this country. We realize how rare and precious it is, and how it's our solemn duty to make sure that we pass along to our kids. And that's what this is all about. So again, thank you. Thank Bobby for making a very difficult decision. I can't imagine how tough that decision was to suspend the campaign that you've been just dedicating your lives to for close to 2 years. All the resources you put into it. That took political courage to do that. And thank you for doing it, because it's created one of the watershed moments. It's one of the necessary ingredients for us to heal and unify and eventually save and preserve this nation. So thank you for doing what you're doing. If you ever come to DC, we've got some great studios. I'd like to sit down and do another podcast in person.
Yes, let's unpack what you've discovered. I mean, it would be wonderful for people to know and understand what the front lines of this looks like. You are an investigator, and the people want to know. So, I'll be out there sooner rather than later. Thank you so much, Senator Johnson.
God bless you.
God bless you.